Hi, my name is Trina Lapsley, and for the Integration of Concepts course, I chose to complete my project on improving CAUTI outcomes, which are catheter associated urinary tract infections, which is proven to be the #1 reported hospital acquired infection. And because we had several CAUTIs on my unit in the intensive care area that I work in, I decided to tackle that task. And so my project included a nurse driven protocol that would allow the nurses to quickly identify a daily need for indwelling catheter and determine whether it's needed or not without the doctor's approval by using evidence-based practice and using an algorithm that will help to determine whether the patient still requires the urinary catheter or not. Although this class was very short, I got a lot done, but I didn't really get to fully do what I wanted to do was actually implement the protocol. So there just wasn't enough time for that. So what I did was I researched it through several outlets, and I looked at different studies that showed that there was a significant decrease in the number of CAUTIs on units that had nurse-driven protocols, and that it had a lot of success nationwide on the studies that I looked at. And so what I did was I presented this information to my manager, to our interdisciplinary team, and also to our unit council. And I completed a pre-test with several nurses and patient care assistants on my unit. There were several areas of opportunity, which was really good because it allowed me to understand what areas we were lacking in, what areas I needed to focus on so that we can see improvement, and exactly what was the concern from the staff as far as a nurse-driven protocol. And the post test was significantly better. But again, it was good that we had that people showed some weakness because it guided my steps as far as how I could provide more information and help our area improve on infection rates. So how does my project relate to the community? Well, even though it is geared towards inpatients in my area as far as indwelling catheters are concerned, #1, there are people that use indwelling catheters in the community, whether it be for urinary retention or a prostate problems or any sort of thing like that. There are people in the community that rely on catheters, and it is important for us to identify early as possible as when we can take it out and provide proper education on how to keep it clean, how often to change it. And so my project, as far as a nurse-driven protocol, would help people in the community because we would be able to quickly identify at what point those catheters can be removed, and also reducing the CAUTI rates in our unit would also allow us to decrease the length of stay, which means that our patients that we love and care for would be able to go home in a timely fashion. And so that is giving back to the community when we are able to care for our patients in a loving, caring way and provide safe, quality, effective care that can get them back into the community and back to their old lives as soon as possible, as that's the overall goal of what we want to do for nursing. And so my project that I did, it helps people in and out of the hospital. I really enjoyed working on this. I learned so much about myself. I learned so many things as far as catheters are concerned, different terminology, uses, when to pull it, bundle protocols, things that we were doing wrong or things that we were doing right. And so this was an excellent experience. So thank you so much for watching my video and for giving me the opportunity to work on something that actually helped me as a person and as a nurse. Thank you.